The objective was for us to, first of all, we need to have a document that we rely on. And from the presentation now, we have what we call process indicator that will give us the document that we rely on for us to implement everything that is necessary to give our people what they truly deserve in terms of healthcare. So we are not working just at the theory. We have a document that we rely on. And from that document, Niger State government has it as a kind of a role model that we want other states to copy from us at the end of the day. There are some challenges in terms of hard-rich areas because we believe Niger State will have a very large geographical setting. So most of our people are rural-based. Then the challenges, we have identified them, and we are working towards that to make sure that every 274 wards that we have in Niger State have the primary health care center, that you can easily just find yourself there to make sure that whatever challenge you may have, you will be able to get it. We do that so that to avoid people coming to the general hospitals, because allowing the people not to be treated at the primary level, then the other hospital will be overstretched. So we are working towards that, and I believe we are getting the result. After we are renovating our facilities, we are also building new ones. Then the state government now, under the leadership of the Federal Ministry of Health, we have come up with a way on how we are going to have enough human resources. We have human resources, but they are not enough for now. We are working towards that, because you cannot just employ without having how we are going to pay them. So we have to look at the financial status and how we are going to sustain whatever employment that we might have made at the end of the day to make sure those who get their salary. There was an existing primary health care in some of those wards. All what we need to do is to strengthen some of those areas that we believe that are existing primary health care. The area that they are not there, we are trying to see, because we must have to take care of our people. And the most important thing we are doing is that we are having a lot of support from the international donors. The state government too is doing its best to make sure we give the best healthcare system to our people.
I thank God for this meeting. Niger State was created in 1976, and I think this is the only first time we have a board like this that looks alive, not dead. I won't say much. We just hope that with this meeting of today, we will continue to meet, and stakeholders in the industry should continue to come and help us. We have a lot of challenges in Niger State. The challenges are the terrain. I'm not saying we have the worst, but we have the largest landmark in Nigeria, Niger State. We comprise of almost Imo, Anambra, and other states. And we have riverine areas, very rocky areas that you hardly reach. So hard to reach areas are our problem. It is glaring now that the government is willing to work and cooperate with everybody in Niger for the benefit of all. I only pray for them to continue with this tempo. And we at the Emirate Council level, all the Emirates, we have 8 of them, will continue to support the government, and we assure them, like I did earlier, that whatever problem they run into, we are willing to come in and help them solve it. The only problem I always see is the issue of the national primary health care in Abuja here, the national one. We hope they will continue to cooperate with us, and they shouldn't boss us, because at times they come into states with programs where we don't have any input, and they put it on our head to say, do this, even where it can work. So I'm appealing to them through this media that the national primary health care in Abuja Area 11 should continue to think and cooperate and co-opt us whenever policies are being made so that it becomes workable. I, on behalf of the traditional institution, congratulate Niger State as indigenous and hope they will keep the tempo.
My name is Dr. Ejike Oji. I'm the chairman of Association for the Advancement of Family Planning, and I'm also the CSO focal point for FP 2020. You know, FP 2020 is a global initiative to make sure additional 120 million women and girls have access to family planning services before 2020. And also I'm the lead consultant for this retreat on the primary healthcare agency of Niger State. If you recall, 2.5 years ago, with the leadership of the then Commissioner, Dr. Jibril Mustafa, and this fine young man here, Dr. Khalilu Mohammed, a strategic document was birthed, which was called Niger State Health 1+0. And that document has made the world know the strategic direction of the healthcare in Niger State. And part of what is happening here, because primary healthcare is the bedrock of making sure that every Nigerite has good health. What is happening here is something I would say is a history being made, that the executive deputy governor of the states is coming to sit down for 2 days, working with the board that he is chairing, the board of the state's primary healthcare agency, to hash out the means and ways of making sure that this thing works. But what enthused me so much in his speech is that he's going to be meeting regularly with his board and even the traditional rulers who own the communities, which is key. And then most importantly, he is so strong on monitoring and evaluation. Because anything you feel you are going to do, if you do not continuously monitor and selectively evaluate your strategies, you have actually planned to fail. I can see a process indicator that this will succeed. They've already attracted a lot of resources. The Gates Foundation is supporting them. Any dollar, they'll match with another dollar. It's based on the concrete things they see the Niger State people are doing. You know, there is Basic Healthcare Provision Fund. That fund is catalytic, and it's a fund that is called an investment fund. Other donors are going to bring money into the baskets. If you remember that the midwifery service scheme was a resounding success, the midwifery service scheme was actually taking services to the rural areas, and that, in a short time, reduced maternal mortality by more than 40%. If the primary healthcare under one roof is taken seriously, that means one primary healthcare reactivated per political word. The outcome is going to be very tremendous. It will crash down all the poor health indicators that is in the States. That I can assure you.
Research has shown that, and even anecdotal evidence show that the primary healthcare is the closest to the people, and then is the first port of call, because primary healthcare is in totality defined, doesn't just include the PHC centers you see, but also community structures and private sector efforts to ensure that the grassroots have healthcare very close to them, of high quality, accessible and affordable. So to the extent that research has shown that up to 80% of people seek primary healthcare, seek health services from the primary healthcare system, it is important for us to strengthen that level of care, because it is also the gateway to the larger health sector. And usually, because it's the first point of contact, any mistake that is made at that level becomes a continuing mistake. I think Niger State has shown tremendous commitment in seeing that the health sector is positioned. It is on record that in 2015, when the current administration came on board, there was no national document guiding the health sector in terms of a plan, because the National Strategic Health Development Plan 1 had elapsed, and then the second one, the 2018-2022 version, had not been developed. And usually the practice is that states will have to wait on the national to develop a framework and the direction for them to key in. But the Niger State government felt that no, this is not the way to go. We must go ahead, develop our own document, something that speaks to our own priorities and our own peculiarities as a stopgap. While we are waiting for national, let's have a plan. And then that's how the Niger Health 1.0 come. Yeah, it is realistic because it takes into cognizance local context, local realities, local capacities, resources available, and even the challenges that are peculiar to Niger State. As we are aware, Niger State is a very vast land, about 10% of total land mass of Nigeria, very difficult terrain. So most time you find out that nationally developed documents have limitations when you bring down to the states, because it doesn't have the capacity to take into consideration all the nitty-gritties that make one state different from the other. So developing a state-led and state-owned document that speaks to the state, for me, is a massive show of commitment. And of course, you've seen it today, that the Deputy Governor is going to be seated here for 2 days addressing issues of primary health care. It is most time when you see very senior people put on executive boards, it is just for the name. it is not functional. There are states where you even see maybe it's even the governor that is the board chair, but it's just to give it that clout. But in terms of practice, they are hardly around. But you can see it for yourself. He is here and he has committed to be here for 2 days, and he also committed that this meeting will be frequent. I think that's a show of commitment.